Hello friends, I am Dr. Anurag Saxena, Senior Consultant Neurosurgeon and Spine Surgeon at Narayana Superspeciality Hospital, Gurugram. Today we are going to talk to you regarding Spina Bifida. Spina Bifida is a condition which refers to a developmental defect in the spinal column of the child, which means that there are certain areas of the spine of the child, bony spine and neural spine, which are not able to form during the development of the child as a fetus. This leads to a defect in the back. It's usually more common in the lower side of the back, but this can happen at the other extremity, that is in the cervical region or the back of the head also. And this defect leads to a swelling which is called as cystic swelling or meningocele, myelocele, and sometimes there can be fatty tissues in it, and it is called as a lipoma. So broadly, spina bifida can be divided into two categories. One is called as a spina bifida occulta, which means it is occult or hidden, which means that the defect you cannot see from outside, and there is a covering of a skin or a fatty tissue over the defect. And the other category is called as spina bifida aperta, or where it is apparent, or where you can see it when there is a defect which is visible, or there is a big swelling of a fluid containing sac which is available. The fluid containing sac can be meningocele and myelocele, which we are going to describe further in this video. Exactly how it happens is, it happens because the spine closes like a zip of a cloth when the baby is in the womb, and during the development, this zip-like closure of the spinal cord or your spine is sometimes hampered at either end of the spine, that is in the upper end or the lower end, and this leads to a defect which remains. And in this defect, certain tissues goes in from like body fat and muscles can go in, and sometimes the neural tissues which forms a tube are not able to form a tube, and sometimes there can be absence or inactive neural tissues inside this kind of swellings, which leads to spina bifida problems. What exactly causes this kind of problems is not known. However, there is a clear association with deficiency of a vitamin called as folic acid in mothers, especially at the time of conception and during the first trimester of the pregnancy. Other causative agents include certain kind of drugs and genetic factors also. So if there is a family history, if somebody in the family is suffering from this kind of disease, then the chances of one having a baby with a spina bifida increases as compared to general population. So when this cystic swelling contains only the fluid or the CSF or the cerebrospinal fluid, then it is called as a meningocele. When this cavity contains fluid and the neural tissues, which can include spinal cord or nerves, then it is called as a meningomyelocele. Because it is a developmental defect, then sometimes the babies can have associated developmental problem in the brain, like building up of the fluid, which is called as hydrocephalus, and sometimes they can have problems in their lower feet, like clubfoot. Very rarely, this kind of babies can have developmental problem in other organs of the body, like heart and gastrointestinal organs. So apart from the swelling in the back or anywhere in the back, like from your cervical spine to lower spine, most of the time in the lower spine, this swelling is apparent, and these patients usually have weakness or less movement of the legs, and their control of their urine and bowels is also hampered. Now, there are a series of diagnostic tests which can be applied before birth. They are called as antenatal diagnostic test, and then there is after the baby is born, then there are certain diagnostic modalities like MRI, and the treatment largely depends on the type of the spina bifida. The diagnosis and the treatment will be covered in the next part of this video. Thank you.